Sertifikatku gara-gara aku dan kehilangan nyawanya. Semua ini, semua.
Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, and have a good time to the ladies and gentlemen. First of all, let us thank to Allah Subhanahu wa Ta'ala because of His blessing, we are able to join in this seminar. Secondly, salawat and salam we send to Prophet Muhammad Sallallahu Alaihi Wasallam for bring us from the darkness to the brightness. Ladies and gentlemen, the presentation today is about understanding non-prescription drug in America and Indonesia. Now, I will read the agenda today one by one. The first session is opening, the second session is introducing, the third session is presentation time, and the fourth session is opinion, question, and answer session. Well, ladies and gentlemen, before we show the presentation, let me introduce myself. My name is Junfidia Heroweti as a moderator. And also thank you very much for the Farmasi Fakulty, WAHID HASYIM University, who has organized this seminar. And now let's open our seminar by saying Basmalah together. Bismillahirrahmanirrahim. Thank you. The next agenda is presentation session. As we know, self-care is most popular today. Many people go to drugstore to buy some drug, vitamin to boost immunity, and self-care support the strengthening and immunity system at COVID pandemic. How pharmacy can support self-care? We can discuss with our speaker. The first speaker is Prof. Yaswan Pata. I will read the biography first. He has completed his bachelor degree until the master degree education at Nagpur, India Department of Pharmaceutical Science at 2014. He got Lifetime Achievement Award in Farmasi at Devi Ahlia University in Indore at 8th International Conference of Association of Biotechnology and Pharmacy. And he edited a lot of books and published like nanoparticle, drug delivery, nanoparticle, and so much more of his experience. And now he is as Dean for Faculty Aware, University of South Florida College of Pharmacy. I can't read all of them, but I'm sure we're taking to one of the great professor. To Prof. Yaswan Pata, please welcome.
Do you want me to start my presentation? I can't hear.
Yep, you have 30 minutes for your presentation, Prof.
Thank you. Let me show my slides. Can you see my slides?
Yep, I can see.
Oh, fantastic. So, Salamat Pagi, and I'm so happy to interact with you all. It's a large number of participants in this conference, and I would like to express my sincere thanks right at the beginning to Ibu Risha and then the WAHID University for inviting me to give a talk on the role of non-prescription drugs in America. I hope, can you recognize this? This is nothing but our Jakarta traffic.
Yep.
Why I'm showing you Jakarta traffic is for my next slide. Selamat pagi, apa kabar? Mohon maaf, saya tidak bisa bicara bahasa Indonesia. Selamat, congratulations to be part of this great conference. Selamat belajar and keep calm and speak bahasa Indonesia. I wanted to share this slide with you all because I showed you the Jakarta traffic. My first time when I landed in Indonesia at the CGK airport, I traveled by a car from airport to Sudiraman. Normally in United States, we would have taken maximum 15 minutes to reach from airport to Sudiraman. It took me more than 3.5 hours. And then I was learning, right? My first interaction with Indonesia, keep calm. You cannot be excited, you cannot be annoyed, you just have to keep calm. And I have seen most of the Indonesians are very calm and quiet and wonderful people there. And then
Thank
they
you.
said, speak Bahasa Indonesia. So I started talking to my driver of the car, and unfortunately, he was not knowing English. I was not knowing Bahasa. That was my first time. And then we started talking about something which was common to both of us, that is Indian movies. And the driver was fan of Shah Rukh Khan and all the Indian movies, Hum Aapke Kaun Hai, and this, that. And we did not even realize we spent 3.5 hours in the car. And that's why I say that keep calm and speak Bahasa Indonesia. That is very important there. Kenalkan, nama saya Yashwant Pathak. Saya berasal dari Tampa, Florida, Muluk, India. This is a beautiful picture of our campus, which is called South Campus of USF, University of South Florida. Saya bekerja University of South Florida College of Pharmacy. Saya Professor, Associate Dean for Faculty Affairs. We are uh, top 50 universities in United States of America. We are ranked 23rd based on the amount of money which we receive as grant from our faculty, close to 500, more than $500 million per year we get as a grant for research in our university. And then we are ranked ninth largest university because on our campus we have 80,000 students, but as compared to the Indonesian universities probably we have less numbers because your universities are much bigger than our university. Ada pertanyaan, any questions for me? So if you have any questions, kindly do write on the chat box and I will try to answer those questions. But I am told that I should talk for 30 minutes and I will try to start my talk. And let's look at, so, there is a concept called self-care. And self-care is like, it is a psychological, it is a spiritual, it is a physical, it is a mental, all different types of things are involved in self-care. So self-care can be asking for help, self-care can be spending time alone, which is very important for your mental health. Self-care can be putting yourself first, asking for what you need, setting boundaries for yourself, staying at home. Now in COVID, most of us are taking self-care by staying maximum time at home, not going in big crowds. We are maintaining the social distancing, we are using the mask, and all these things are very important. They are also part of your self-care. And one of the important aspect is saying no. Sometimes you are involved or you get involved in certain scenario where you need to stand up and say no, because that is part of your self-care. You need to be confident to say that no when it is you are convinced that this is the bad thing which can happen to you. And then forgiving yourself is also part of the self-care, because we all make mistakes, and then if we are too harsh on ourselves, then that will create a problem for us. So self-care covers so many different aspects. So as the US and the rest of the world is trying to reopen the economy and continue battling COVID-19, it is important to realize that these times can be demanding. We all are facing this pandemic, whether you are in Indonesia, India, or in United States, everybody of us, and the numbers now, in more than 1 million people have lost their lives, and in United States we have more than 200,000 people have lost their lives. So it is a huge loss. I'm just looking at the number. So 1,072,146 people have died till this moment. More than close to 10 million people are suffering from this pandemic, and almost 75% of have recovered from the pandemic. In American scenario, we have 2.6 million people suffering from pandemic. They are still active infected patient. 218,000 have deceased or died. But in case of Indonesia, you are doing fantastic and phenomenal. I must congratulate you all, because today in Indonesia only 65,000 people are active infected by COVID-19, and only 11,617 people have died. So if you look at the comparison of United States and Indonesia, Indonesia has performed absolutely significantly better than the United States, and I must congratulate you all. So in order to combat the stress you may incur, you must understand the importance of self-care. So when you are dealing with this pandemic, this is the chart, taking step back, forgiving yourself, saying no. These are the basic concepts of self-care, and we need to adopt them. And it is also important for our talk also. So there are several different self-care techniques that will help you to reduce stress at work, and each of them provides significant benefits to the people. And it is essential to manage your time well enough to be able to practice these techniques. And that's why I showed you the traffic in Jakarta, because at some point you have no control over your time, because the traffic doesn't move for 2 hours. And in such scenario, you need not be very apologetic, because it is beyond your control. And at that time, forgiving yourself, and then uh, rethinking whether you really want to attend the program or not. So these are the things which we need to call a part of the self-care. And if we learn more about self-care and how it can help reduce accumulated stress, its impact is on your immune system. And especially in COVID-19, we are learning that our stronger the immune system, better we can protect ourselves. And this is where your self-care is very important. So the defining self-care, there is no single definition of self-care, but it is often described as performing a series of actions to improve your physical, mental and emotional well-being. And practicing the self-care means working to eliminate as many triggers of stress as possible. And this is where I am going to take you to the non-prescription drugs, because in many cases, those non-prescription drugs are a major part of your self-care processing. And that is where I am going to, so unless we understand this self-care, it will be easy to understand the non-prescription drugs later. So this does not mean that you are prioritizing yourself or anything or anyone else. It simply means that you are relaxing and recovering in order to perform at the best of your ability when needed. And it is very self-defeating, if it is not impossible, to try to care only for others at the expense of yourself. So this is very important principle of self-care. And self-care comes in many different forms, from taking a small stretch break at work to practicing guided meditation at home. And you can see this self-care is a big umbrella which covers taking time for yourself, staying hydrated, putting your health first, going outside, fueling your body, being genuine, practicing forgiveness, acknowledging your feeling, mindfulness, meditation. All these are part of the self-care. And as you are going through this huge pandemic, we all are going through it, we are understanding that self-care is one of the most important aspect of human health care around the world. And by wearing our mask, we are not only taking self-care, but we are also protecting the other person next to us. If suppose I have a temperature, I have a fever, If I don't go to work, then I am not only protecting myself, but I am protecting the other people also. And this is where the concept of self-care once and comes, and it is a growing concept in the healthcare system. So non-prescription drugs are a part of your self-care pharmacotherapy. So when you say that, hey, I have a running nose, it is very easy for you to go to the pharmacy and take some drugs which are used for cold and cough and flu, and you protect yourself, and because of you protect yourself, you are not communicating that viral infection to the other people. So self-care can be very helpful if you know the availability of non-prescription drugs, and if you know the how to use them. And that's why self-care pharmacotherapy is a part of healthcare, major healthcare, and we'll discuss that in future other slide. But I would like to impress upon your mind that taking care of yourself is not a selfish activity. Taking care of yourself is a self-care activity. By not interacting with other people, you are protecting other people. By not going when you are suffering from a disease, viral infection outside, you are protecting not only yourself but your family and all the members of the society. So we, especially in this pandemic, this self-care pharmacotherapy and self-care concept is growing very well, and growing all over the world. And I hope in Indonesia also, I heard that a lot of activities are being practiced by Indonesians for the as a part of the self-care and then self-care pharmacotherapy also. Another thing I always talk whenever I talk with people in Indonesia, jamu is a self-care. And jamu, Indonesian jamu can protect you from many simple diseases, many of these healthcare challenges, and jamu becomes a self-care pharmacotherapy. So never ignore what our parents and our ancestors have given to us, but improve that so that we can use it as a self-care pharmacotherapy. And I strongly recommend you to look at jamu from a self-care pharmacotherapy, a non-prescription drugs, and make use of it so that we all can be healthy. So many such disorders can be self-treated with the use of simple home-based technique. That is what jamu is, and well-recognized non-prescription drugs. So this is a very simple way of reducing the healthcare cost as well as providing healthcare to a larger community. And like Indonesia is fourth largest country, and definitely this is important. So you will say, look at this caption here, what type of self-care is this? So using a first aid bandage is sickness self-care. Chicken broth, they use it, sickness self-care. Use orlistat, sickness self-care. Regular exercise is preventive self-care. Taking vitamins is a preventive self-care. Using home blood glucose meters is a sickness self-care. So you can put this list, a long list, you can have it, and you can find that you do certain things for preventive self-care, you do certain things for sickness self-care. So doing exercises, doing yoga, doing meditation, doing breathing exercises, running, jogging, biking, all these things are very important. I used to be in Surabaya, and I used to walk 5, 6, 7 kilometers, and there was no walking path there. And I used to tell all my friends in Surabaya that, hey, you should go to the mayor and say that we need a walking trail so that we will be able to do our preventive self-care, because walking is one of the best way of preventive self-care. So defining the from pharmacotherapy, self-care is an independent act of preventing, diagnosing and treating one's illness with seeking physician's advice. So in many cases, when you are growing, you learn that this is what my body needs, this is what my body can accommodate, and I can take these things. So non-prescription drugs become a very important aspect of self-care. And then self-care is classified into two different areas. One is called preventive self-care, as we discussed, involves maintaining well-being, appearance through exercise, healthy lifestyle, This includes nutritious diet using vitamins, minerals, nutraceuticals, herbal supplement, also including dental, hair and skin products, going to the massage therapist, going to acupuncture, acupressure. All these things are preventive self-care methods as a pharmacotherapy. There are sickness self-care where you suffer from certain diseases, and now you go to the pharmacy, you look at the drugs there and which are readily available to you, non-prescription drugs, and then you can buy them and prevent further communication of that disease to other people as well as recover yourself. So if you are unwell, unsure, choose what you want. Cough, cold, choose a good thing. Sore throat, choose a self-care. Feverish child, take a self-care. Deep cut, use bandages and all those things. And severe chest pain, then you have to go to the doctor. So these are the sickness self-care which are very important scenarios. So preventive versus sickness care. So hair care, skin care, weight control and nutritional food, vitamin, dietary supplements, controlling your weight is one of the most important self-care, because when I was talking to my friends in Indonesia, like in America, you have a problem which is going on everywhere, and that is obesity. And obesity can cause several different kinds of chronic diseases over the period of time. So obviously, if you control your obesity right at the early age and continue, you can be very healthy at your latter age. And this is where I would like to strongly recommend you to look at the jamu. There is a very nice jamu siri which helps you in weight control. There are many different jamu preparations which are very good, and those are all preventive care. And then first aid, antacids, laxatives, pain relief, cold and allergy, all these type of non-prescription drugs are considered to be sickness care. So, self-care during crisis. Now in COVID-19, everybody in America is trying to do self-care during a crisis like pandemic. So a lot of people have adopted a meditation practices. They sit calm and quiet in a secluded place in their home, and then they just concentrate on themselves, introvert thinking, and that meditation is helping them to reduce down the stress. Sitting alone and just thinking nothing is a wonderful way of reducing your stress. Then staying active, doing a lot of exercises, home-based exercises, that is another thing which is important. One of the very interesting thing which people have adopted in America is not watching the TV and not watching, avoiding the news. And this is where people have realized that by watching the TV and news, it builds up a lot of stress in your mind. So if you watch TV news for like 7, 8, 10 hours, then it will build up a huge stress in your mind. And that's why people are saying that avoid the news, don't spend too much time on avoiding watching the news. Then avoid people pleasing. Don't please people and then sacrifice yourself. It doesn't help you. And hence, we need to be very cautious about to whom to please and whom to say no. Talk to the loved one. This is another thing. In Indonesia, WhatsApp is a big thing, and every person is so active on WhatsApp. So that really helps you talking to the loved one, and thinking realistically and not getting panicky is another way of self-care in COVID-19 crisis. So there are commercial products which are used for self-care, and these are often known as health and beauty care products, HBC products. So you have lot of products which are available in pharmacy. They may not have any drugs, but they really help in self-care, your skin care. There are so many products for skin care, hair care, dental, but all these products really help you in maintaining yourself healthy. And these are very useful products, and we should be using those regularly because that is part of your self-care. The consumer poll in America has shown that 66% of the people in USA make their own selection of HBC products, home beauty care products, while 44% consulted their pharmacist before selecting any OTC or ABC product. And the pharmacist plays an important role in assisting patients seeking both preventive and sickness self-care products in USA. So here, as you start using them, gradually you build up your own knowledge about the product. So you use several different brands, and then finally you stick down to a particular shampoo which is good, a particular conditioner which is good for your health, a particular toothpaste which is good for your health, a particular floss which is good for your dental health, a particular vapor rub, Vicks vapor rub, or some pain balms are there. So not necessarily every pain balm will be comfortable to you or reduce your pain, but these are the products which are readily available, and these are part of your self-care. So in this self-care process, 66% in USA, they make their own selection based on their previous experiences for years, while 44% keep on talking to the pharmacist, asking their questions about what is a good OTC, because the pharmacist is the one person who really deals with, in America, normally in one day, they fill around 300 to 600 prescriptions. So one pharmacist interacts with minimum 600 people for prescription. Plus there are a lot of people who are asking questions about OTC. They have a exchange communications, and that is where pharmacists also on the counter keep on learning from people what is good, what is not good. So pharmacists will say, oh, I have 10 patients who have been using this cream and it helps them in a dry skin. Now dry skin is a problem because that can lead to different kinds of skin diseases. And in such scenario, a simple moisturizing cream can become a part of self-care, and it is a non-prescription. It is available over the counter, and we need to use them as part of the self-care. So some of the common applications of the self-care products in US market are 70% of the products in a US market, non-prescription market, are pain related. So you have ibuprofen, aspirin, you have paracetamol, and different types, naproxen is there. So you have many different types of brands and generics, but 70% of the US market has a lot of pain products are there. Then there is a 52% non-prescription drugs in America are cough, cold, flu, sore throat. There are 45% are allergy and sinus challenges, because in here probably, I don't know, I always make a joke that if you want to become a US citizen, you need to have at least one allergy. If you do not have allergy, they don't give you US citizenship. I'm just joking, but this is allergy is a very common thing. If you stay in certain areas here, and especially when there is a pollen time, your car, if you keep the car outside, next day morning, you will find that your car is completely covered with the pollens. And that pollen can cause lot of sinus challenges and allergies, and it is a very big problem, and lot of people keep on taking this allergy medicine. Then heartburn and indigestion, especially people who are non-vegetarian, those who eat raw meat, they always face this heartburn and indigestion, and almost 37% of the market is belonging to the indigestion and heartburn thing. Constipation, diarrhea, and flatulence is another challenge which is there, which is 21%. Minor infections are 12%, and skin problems are 10%. So this is the major non-prescription care, self-care products in US market and their percentages. Now, interesting survey findings about opinions of healthcare professionals about non-prescription drugs in USA market. So 93%, they are, this is a beautiful picture here. It is benefits and safety. You have to weigh, is the non-prescription drug safe for me, and am I getting the right benefits or not? And this is a balance you have to always keep in mind when you use those. And that's why 93% of the physicians in America believe it is important that medications for minor ailments be available over the counter, because a lot of medicine, a lot of problems, health care problems can be easily resolved with non-prescription drugs, and that reduces the burden on the hospital, that reduces the burden on the doctors, and that's why 93%, I mean, 93 people out of 100 physicians, they believe that OTC non-prescription drugs play an important role for minor ailments. You don't want to go to OTC drugs for your heart attack, that is pretty sure. If you have a stroke, brain stroke, you don't want to go to OTC to find out what will help you. But if you have a cough and cold, if you have a indigestion, you should go there because it will reduce the pressure on healthcare as well as the cost of healthcare will be reduced. 96% consumers believe that non-prescription medication make it easy to self-care for minor ailment, which is a major because most of the, due to the high education levels here, most of the people are very well aware of it, and now with the online and web information, it is very easy for everyone to understand the OTC drugs and then find out the benefit and safety balance and then use them. 87% physicians and 89% consumer believe OTC products are important part of overall family and individual health care. 93% adults prefer to treat minor ailments with OTC product before seeking physician's help, because if you want to go to the physician, you have to pay at least $40 for your first visit, and that's where if he is not in your home medicine organization HMO, then you pay more money for the specialist, and this is where people say that, hey, for my cough and cold, why should I pay $40 rather than that I'll go to the pharmacy and take a medicine costing $5 and I will be relieved from cough and cold. And this is how the OTC products are playing a major role in the healthcare of United States. And 88% physicians recommend patients address minor ailments with self-care before seeking professional help. So most of these non-prescription drugs have labels which say that use ibuprofen for 3 days continuously, but if the fever persists, then contact your physician. Use paracetamol for 5 days and then contact your physician. So these type of instructions are on the labeling of non-prescription drugs, so they know that if the fever is not going after 3 days of dosage, definitely there is more to it and you should contact your physician. So this is why in 90% of the cases, in 3 days you will lose your fever, you lose your cough and cold, and you will not have any problem. But if you have a pneumonia, now in such cases, after 3 days, don't continue taking the OTC, but go back to the physician and do all the testing, do all the diagnostic testing, and that's where those signs, those label instructions are given, and that is very important to follow those instructions to avoid the challenges. So there are some other surveys which I brought it for your information. Is non-prescription provides annual savings up to $102 billion due to access to the OTC product. Each dollar spent on prescription Medicare is $6 to $7 for the healthcare system. 79% consumers, approximately 240 million people, took non-prescription drugs in various categories. So, majority of the people out of 300 to 40 million take that. 180 million people would seek treatment from primary care provider if non-prescription medicine is not available. And self-care medication plays important role in chronic disease such as aspirin for reducing heart attack risk, fish oil to help manage certain dyslipidemias, glucosamine and chondroitin to relieve symptoms of osteoarthritis, and so on. So here is a chart of various drugs, non-prescription drugs which are used for antidiarrheals, analgesic, external, acne remedies, food preparation, sunscreen, sunblock, lip remedies, eye care products, smoking cessation products. And you will find that because of this allergies, lot of drugs come under the cough, cold and related products. Analgesics and internal includes other pain products are also large. So you can find the largest number of non-prescription drugs fall in analgesics and cough and cold preparations. So this is the patient cost and average cost in US dollars, and you'll find that if you go for a brand and if you go for a generic, the prices are different. Aspirin 80 milligram, which is very good for heart patients. If you buy a generic brand, you will get 100 tablets in $1. If you buy Bayer's brand, it will cost $8. So obviously people will look for generic brand, and this is where the cost vary, and you will see for each of this from 2013 to 2017 the costs are increasing from $308 to $415, and for each of these different categories, brand, generic pharmacy price, generic final out of pocket cost, all product final out of pocket cost. So this is what the challenges are. So as you move into the non-prescription drugs, your healthcare costs significantly go down. And if you use like brand, you'll be paying $415. If you use plain simple generics, you'll pay around $5.76. So this is a tremendous difference between the amount you pay for brand and generic, and this is where the non-prescription drugs are helping the people on large scale. Total spending on medicines and growth and outlook, what is expected is in 2022 is US $1 billion. It is going almost close to 600 $1 billion. It went there, now it is coming and it is going up around $300 billion expenses going on, which is forecasted. So a lot of money is put there, and then people are expecting that if they get the benefit, then consequences is the healthcare cost, total healthcare cost is reduced significantly. So non-prescription medication provide 102 billion in value to the US healthcare system annually. Of 77 billion is from clinic office visit savings. 25 billion is the result of drug saving. So you have 4 out of 5 American adults commonly take non-prescription medicine. Most of them treat the acute ailments, and the top sell categories are analgesic, heartburn, upper respiratory infections, first aid, toothpaste, and all those things. So these are very important aspects of it. Non-prescription drug medication trends are there, and they are growing. Nowadays, what people are doing is they are trying to put many drugs which are safe, and based on the balance and benefit, convert it into the, once the patent is expired, then they try to get it into the non-prescription. But you have to be careful. There is a possibility of potential misuse or abuse is comparatively low. Consumer can use themselves self-diagnose condition. They are labeled adequately. Health practitioners are needed for the safe and effective use of the product. And several non-prescription medications are recommended as first-line therapy according to clinical guidelines. And there is a non-prescription drug handbook, which is a very big book and useful and readily available online. You can see now how the changes are happening. This is a non-prescription medication recommended as first-line therapy and by American Academy of Otorhinology, American Academy of Colleges of Gastroenterology. So you have different types of national organizations which are providing you to use your intranasal corticosteroid, second generation antihistaminic, PPI, nicotine replacement therapy, folic acid. So these are all non-prescription, and they are used for some very good evidence-based practices for clinical treatment. So misuse of non-prescription medication is another challenge which is there, but there are more than 100,000 non-prescription products on the market and more than 1,000 active ingredients from which to choose. And this does not count numerous dietary supplement, vitamins, and non-FDA approved products sold in pharmacies. So there is a convenience and cost make them appealing to most of the consumers who need treatment. However, 1 in 5 adults who self-medicate admits to taking more than the recommended dose. So many a times people take ibuprofen 300 milligram, the pain is not going. Another 300 milligram, in another hour you take 300 milligram. But the patient doesn't understand that within the span of 3 hours, you have taken 900 milligram of ibuprofen, and that is definitely going to affect your health. Same thing with paracetamol, same thing with naproxen. So you need to have that control on your mind, otherwise you can misuse those non-prescription drugs which are readily available. And it is obvious as non-prescription medical trends I have discussed earlier, that laxatives, diphenhydramine, sleep, antacids, H2 blockers, heartburn. Omeprazole used to be a prescription drug once upon a time. One tablet was costing $35. Now you get 10 tablets for $3. So these things are changing, and it is helping a lot. So this is a big busy slide, but I will share this. I have already sent this to Ibu Risha, and she can share this prescription with you all. So this will give you adult dosage, product category, year approved and product. Example, these are in US market. There is a trend that a lot of prescription drugs get transferred to the non-prescription switches, and there is a economic reason also, and there is a once the patent is gone, then the people do not make as much money because there is a lot of generic products. That's why they try to switch the prescription drug to the non-prescription drug, and 7 of the past 14 switches are in the allergy category. Because the consumption is higher, the lot of drugs are transferred to the non-prescription switching. So the other statistics, there is a considered following. There was a 150% to 200% increase in the purchase and use of nicotine replacement therapies as soon as it was switched to non-prescription. So obviously there are certain advantages why people are doing that, and even FDA is also encouraging that if safe drugs are available, let it be moving to the non-prescription. So special population, there is another thing, as we all know that aging population is growing, and there are a lot of um, drugs which are available on non-prescription for senior citizens, and there is a lot of opportunity for treating senior citizens at home, and that is where the non-prescription drugs can be part of a major self-care for the scenario. Same thing happens with your children, people who are handicapped. All these people, they need support. They need some simple medications, and that can non-prescription drugs can really help them into the system. So conclusion, I am almost running out of my time of 30 minutes. So conclusion is non-prescription medication can be effective, safe if taken correctly. If you make a mistake, if you take too many of them, it is going to show you bad side effects. So it is very careful. Non-prescription medication can be effective and safe if taken correctly. And pharmacists need to take the lead in preventing and identifying intentional and unintentional misuse, as well as understand where non-prescription medication fit into the therapy, so we can encourage safer and smarter use of these medication. So people like you who are pharmacists, who are apothecars, so these all, we have a role to play. We have to make sure that non-prescription medications are available to the right person, right time, at a lower price, and then can be advised correctly so that there won't be any side effect for this non-prescription drug. And it is a major part of American healthcare system. Terima kasih. Uh, Thank you very much. It was so nice to talk to you all, and I will be waiting for your questions. And once again, terima kasih. And I will be online to look at your questions later. And I would like to request Risha ji to go ahead with her presentation.
Okay, thank you, Prof. So great presentation. You give all of participants the overview self-care at America. For the participant, you can send your question at a Q&A column, but we continue with the second speaker, Miss Risa Filavitria, because we panel seminar. Miss Risa Filavitria. Who doesn't know Miss Risa Filavitria? She is head of pharmacy study program at WAHID HASYIM University. She completed her master degree at Gajah Mada University, pharmacy management, and graduated at 2010. And then several journals that have been written, antityrosine activity from various solvent, operation cell extract in vitro, and of course, there are many journals that I cannot submit one by one. Thank you for you taking the time to discuss Miss Risa Filavitria. To Miss Risa Filavitria, please welcome.
Thank you very much, Miss Vidya. Miss Vidya, you look so awesome today.
Thank you.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
May God bless us today. My dearest Professor Pata, how are you?
Fine, thank you.
We know that it's 9 p.m. in Florida right now. You must be very sleepy right now, Prof, right?
Yeah, I'm
But
going to
yeah,
awake till the question answer is over. Yeah.
but you still want to spend your valuable time with us. So kind of you, we really appreciate that. Thank you very much.
Oh, sama-sama.
My dearest colleagues and my dearest students, I hope that you always be healthy. Although we couldn't see face to face, but it's my pleasure to be here with you all in this forum. In this opportunity, I would like to share with you about role of non-prescription drugs in Indonesia. I believe that all of you are very understood about this rule, but I think there is nothing wrong if I remind you again about this. Well, who knows, maybe you will be able to see if you have already followed this rule or not, especially you who act as a community pharmacist. But I'm sure that none of you infringe this rule. Before we take a deep look into this rule, let's see that according to Indonesian Ministry of Health regulations, there are four medicine categories that are narcotics, potent medicines, limited free medicines, and over-the-counter medicines. From now on, let's say drugs as medicines. Pharmaceutically, all medicines are drugs, but clinically, not all drugs are medicines. Drugs, most of which would be medications that are illegal to produce for own use or for sale. That's why we better to call it medicines rather than drugs. That's what I know from YouTube and other English literature. Okay, now let's see one by one. The first one, we have narcotics that are marked with a red circle logo and a plus sign in the middle of the medicine package. As we know that narcotics can cause loss of consciousness and numbness, so all medicines in this list are under strict supervisions by Ministry of Health. And second, we have potent medicines that are marked with letter K in red circle with black outline logo on on medicine package. The phrase must be with medical prescriptions must be printed on blister, strip, vial, ampoule, tube, or on any other packaging if the packaging is wrapped in an outer wrap. Psychotropic medicines are also classified as potent medicines with the same logo. This type of medicine can be dangerous if it consumed carelessly, such as aggravating disease, poisoning the body, and even causing death. For reason of use, it must be monitored and in accordance with the recommendation given by the doctor. The third one, we have limited free medicines that are marked with a blue circle with black outline logo on medicine package. It is actually potent medicines, but however, it still can be sold and purchased freely without medical prescriptions with the warning sign on the package, which we will discuss on the next slide. Its use is limited only for one treatment regimen per case, depend on certain diseases. For example, maybe we give paracetamol for fever for only 3 days. If the condition of the disease is getting serious and doesn't heal after 3 to 5 days, then we should suggest the patient to see a doctor. Therefore, all limited free medicines and over-the-counter medicines are required to include a warning sign. If pain continue, please immediately contact a doctor. The fourth one, we have OTC medicines that have green circle with black outline logo on medicine package. These medicines can be sold and purchased freely without medical prescriptions as well. And these medicines can also be found on drugstores, grocery stores, and supermarkets. That's because these OTC medicines have active substances that are relative safe to use. These medicines do not require medical supervisions as long as they are taken according to the instruction on the packaging. So patients should still buy the OTC medicines along with the packaging. As we can see here, we have 6 cautionary labeling for limited free medicines. As you can see that all 6 cautionary labeling have the same sign, which is awas obat keras in Indonesia. In English mean warning potent medicine. So again, that this kind of medicines is actually potent medicines, but we can use it without medical prescriptions for minor ailments. As I mentioned before, that potent medicines can be dangerous if consumed carelessly, so these labels are made to warn us. Then, after warning potent medicines label, we have six different cautionary labels. The first one, we have read the directions. That means we have to tell our patients to strictly follow the directions on the packaging, like how much they should take the medicines, for how long, and how many times a day the medicine should be taken, etc. The second cautionary labeling we have just for gargling, do not swallow it. For example, Listerine and Betadine mouthwash. That is a brand Indonesian medicine name for mouth. And the cautionary labeling number three, we have external use only. For example, Calpanax for tinea versicolor infections or betadine solution for wound and cut. And the cautionary labeling number four, we have only to be burned. For example, we have Molexidine, that was medicine for sterilization of skin and antiseptic mucous membranes before and after surgery for viral fungal skin infections. And the other example was asthma cigarettes, but all medicines with warning sign number four are no longer available anymore in Indonesia. The cautionary number five, we have not to be taken internally, for example, for vagina. And the cautionary labeling number six, we have hemorrhoid medications, for example, hemorrhoid suppository. Now we get into our core point of the role of non-prescription medicines for self-medications in Indonesia. Only we can see that here that only some of potent medicines, limited free medicines, and over-the-counter medicine can be used for medications. According to WHO, self-medications can be defined as the selection and the use of medicines by individuals to treat self-recognized illness or symptoms. According to WHO, self-medications aims to improve personal health, treat minor illness, and manage routine treatment of chronic diseases after doctors' monitoring, while the functions and role of self-medication is more focused on treating symptoms quickly and effectively without prior intervention by medical consultants, except pharmacists, as to take as to reduce the workload and in condition of limited resources and manpower. So, as I mentioned before, that some of potent medicine can also be given without doctor's prescription, which are included in OWA, that is Indonesian abbreviation for Obat Wajib Apotek. That means medicines that must be available at the pharmacy. Medicines therapy classes that are included in OWA are oral contraceptives, gastrointestinal medicines, mouth and throat medicines, airway medications, medicines that affect neuromuscular system, antiparasitic medicines, and topical skin medications. And only limited free medicine and over-the-counter medicine can be advertised. uh, so many factors that can be so many factors that can influence the implementation of self medications in Indonesia. I believe that maybe we have the same factors at the other country maybe, but mostly the first one we have the most factor that influence the implementation of self medications is pharmacy staff. How pharmacy staff or pharmacists or apotheker in Indonesia convince patients about the medicines they offer regarding the conditions that the patient complains about. Usually, they offer medicines that are available at the pharmacy. Well, it's undeniable that we must be profit oriented in addition to patient oriented so that our business can keep going. The next factor is advertisement and knowledge. That through advertisement, patients are familiar with the name of these medicines and understand very well when experiencing the symptoms mentioned in the advertisement. They will look for these medicines and say the medicine's name when they go to pharmacy. Even if the patient is someone who understands about health science like us, it will greatly affect the implementations of self-medications. And the third factor is occupations and income level, whether a patient is works or not. Then the level of income will greatly affect the implementation of self-medications. Combined with explanation from pharmacists and advertisement that they have ever seen as well. And this page is about Indonesian pharmaceutical market from 2009 until 2013. Well, actually, I'm not very familiar with the accounting terms on the chart, but we can see together here that the sales of OTC medicines are quite huge under the sales of prescriptions medicines. And some of the study says that the prospect of OTC sector sales in Indonesia will remain robust. We can see here that this speak is about OTC pharmacies pharmaceutical revenue from 2012 until 2025. In general, the OTC pharmaceutical market is expected to continue high positive growth until 2025. As we can see here that the cough and cold remedies and analgesic segments together account for more than half of total revenue, especially due to the major sales of aspirin, ibuprofen, paracetamol, and remedies against flu-like infections. According to Indonesian Ministry of Health Regulations number 919 on 1993, there are four self-medications criteria. The first one, the medicine should not contraindicated for use in pregnant women, children under 2 years, and parents over 65 years. Self-medications using OWA is not provides a risk for disease severity, and its use doesn't require special tools and methods that must be assisted by doctors, nurses, and other health workers. This use is required for diseases with high prevalence in Indonesia. The drug has a safety ratio that can be accounted for self-medications. Now, according to Directorate of Community Pharmacy and Clinic Development, General Directorate of Pharmacy and Health Equipment Development, Department of Health 2006, there are 15 minor ailments for self-medications. The first one we have cough. Cough can be caused of many diseases, for example, lung infections such as pneumonia, tuberculosis, or even lung cancer. But some of cough could be just caused by some allergies. So to relieve cough, these are medicines that are included in aforementioned rule. As we can see here that we have obat batuk hitam for expectorant, or in English we call it black cough syrup that consisting of succus liquoriaceae extract, paracetamol, ammonium chloride, ephedrine HCl, and chlorpheniramine maleate. And we have dextromethorphan HBr for antitussive. For your information, HBr stands for hydrogen bromide. The second, we have influenza. Symptoms of influenza include fever, headache, muscle ache, watery eyes, coughing, sneezing, runny nose, sore throat, etc. We can suggest medicines for patients based on symptoms that appear. For example, maybe antihistamine for allergic reactions or oxymetazoline nose drop to reduce nasal congestion. And then we have ringworm and tinea versicolor. Ringworm in Indonesia is uh, kudis or kurap, yeah. And ringworm or tinea versicolor are fungal skin infection. And we have fever and pain. I believe that mostly people in this world have ever experienced this illness, so these medicines are very familiar to people as well. Regarding diarrhea, the most recommended medicines to treat diarrhea is ORS, oral rehydration therapy, or in Indonesia we call it oralit, to prevent lack of body fluids, and we can use carboabsorbents to absorb toxin in the intestines. And we have also prickly heat. Prickly heat in Indonesia is biang keringat that can cause irritation to the skin, especially in babies and children. Okay, now we see that for ulcer, there are medicines that neutralize or inhibit the productions of excess stomach acid, a type of antacid, or medicines that block the productions of acids that improve intestinal motility or bowel movement system. Those are medicines that can be used to help overcome worms and acne disorders. And we have dandruff. Dandruff is the exfoliation of the scalp in small amounts from normal looking scalp, which can be caused by inflammations or fungal infections. And we have scabies. Scabies in Indonesia is gudik, or in Javanese is gudikan. Scabies is a skin disease caused by parasites, namely mites, and it's so contagious. And we have warts. Warts is a cutil, are growing tissue caused by viruses. And for burns, medicines are used for first aid medicines before patients goes to the emergency department in hospital. And we have also povidone iodine to wound and cuts. Okay, let's see that we have two two important that we have to give to patient about medical self medications. The first one, we have to give medicines that have been proven safety, efficacy, and quality. And we have to provide the necessary informations to the patients or patient's family. And those are informations that needs to be conveyed to patients. The first one, of course, regarding drugs efficacy. Uh, we are, as a pharmacist, needs to explain clearly what the medicinal properties are relevant according to the indication of the health problem that experienced by the patients. And about contraindications, patients also need to be clearly informed about the contraindications of medicines given, as not to use them if they have contraindications referred to. And then patient also need to be given information about possible side effects, as well as what have should be done to avoid and to overcome it. How to use must be clearly conveyed to patient to avoid misuse, whether swallowed, inhaled, applied topically, inserted through anus, vagina, or any other means. And about dose, according to the patient's health conditions, the pharmacist can advise dosage according to that recommended by the manufacturer as directed usage stated on the label, or we can suggest another dosage accordingly with the knowledge that we have. And about the usage time, must be also be clearly informed to patients, for example, before or after meal or when going to bed. The durations of medicines use must also be informed to patients so that they would not use the medicines in a long-term manner. And things that must be considered when taking the medicines, for example, abstinence from food or not taking other medicines in time simultaneously. And what should patient do if they miss a dose or of their medicines? If patient forget to take the medicines, is it okay to take the previous medicines or just take the next dose? And about how to store medicines, is it stored in cool, dry place or certain temperature? How to distinguish between good and damaged medicines, and about remaining medicines if patient already been healed from the disease they experienced, whether it can be stored for a certain time or it must be disposed of, and we can tell patient how to properly dispose the medicine. Now, what we can conclude is what is important when we do self medications for patients. We must understand the updated rules, and then we continue to upgrade our knowledge, of course, regarding the symptoms of the disease and its treatment, as well as the all information related to the disease and its treatment. Because it would be very funny when if patients come to pharmacy and then we go like, hold on, wait a minute, yeah, and I will open my book first. That will make us look unprofessional as a pharmacy. Yeah. Okay. Thank you very much. Arigato gozaimasu ni. Sisianimen. Hatur nuhun. My colleagues and my students for your great attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. So thank you, Miss Risa. It's so amazing presentation. Okay, now we come to opinion, question, and answer session. I will read the Q&A from the audience. There are so many questions. Okay, the first question for Miss Risa. Based on the market, we can see that the increase in self-medication is mostly in hard drug and OTC. How do you educate the public that the consumption of nutritional preparation is also very important? It's from Nora Miranda. Oh,
Okay. Thank
yeah.
you, Laura. I think you mean potent medicines, yeah? Not hard medicines. And maybe you mean some kind of multivitamin like vitamin B complex or vitamin C. As we know that in Indonesia, multivitamins are included in as OTC medicines. Of course, we don't need doctor's prescriptions for that. We can educate also to public about the importance of vitamin consumptions, especially to help improve our immune system and or to accelerate healing the disease. Yeah, maybe we can make some leaflet through health promotions, yeah, and then we can give to patients and give some explanations about that through community events, maybe such as recitations or community or social gathering, etc. I think that's
Okay, thank you, Miss Risa. And then the second from Nana, she want to asking to Propata. Is there a limit on the drug criteria which can be given for self-care? Like in Indonesia, maybe obat wajib apotik or medicine that must be available at a drugstore maybe. Maybe at America have a regulation which drug can be given for self-care, Prof. Patak?
There is no such regulation per se because
Okay.
they are readily available and they are not controlled by the pharmacist.
Oh,
If you go to any pharmacy, normally in America, most of the pharmacies are also big stores. So they not only sell the drugs, so anything which is prescription drug, those are controlled by the pharmacist. Rest everything is uncontrolled market. So obviously non-prescription drugs, if I go there, I can buy, like there are big grocery stores, Costco. So if you go
Okay.
to Costco, you can buy 1,000 tablets of calcium, 1,000 tablets of multivitamin. You can buy 1,000 tablets of ibuprofen, 1,000 tablets of paracetamol. So there is no control on the quantity which you can buy.
Okay. So,
But the problem comes when, if the person takes overdose of the drugs, then the challenges come into the picture. And at that time, he has to tell the physician and then get admitted to the hospital, and then people start knowing it. So that whole case will be publicized in the newspapers. It will go on TV, it will go on. So people awareness is increased by publicizing such type of incidences, that a person took 15 tablets of ibuprofen and was admitted for ibuprofen poisoning. So this is one aspect. That second aspect is in uh, almost every big cities, and most of the pharmacy colleges, they have a organization or a system called poison control system. So if some of our pharmacists, like in our college, we have a pharmacist who is expert in dealing with the poison control. Poison control in the sense, ibuprofen is a medicine. When you take 100 milligram, ibuprofen becomes poison when you take 1,000 milligram. Does that make sense? And it is applicable to every medicine also. Every medicine, paracetamol, you can take it 300 milligram, you can go up to 1,000 milligram. But if you take 1,000 milligram for 7 days, there is a possibility that you will start internal bleeding, you will start liver toxicity, and it will show the poison effects of these medicines, even the non-prescription medicine. And this is where there are online advices to the people. So if there is a side effect seen, they immediately call this poison control department, and then the poison control will say, "Oh, you took ibuprofen. Okay, take this particular medicine, and that will reduce the side effects." And this is where they control it. But as far as buying the things are concerned, you are free to buy. In America, you must be aware that we can buy as many bullets
okay.
also.
Okay, okay. Prof. Pata, so about the narcotic, can we buy without prescription?
Narcotics are not given without prescription, but narcotics are readily available on the street.
Oh,
Narcotics is a huge business, and it's a billions of dollars business around the world. And the way in Indonesia, if somebody is found with narcotic drugs, they hang the person to the death. That is what death penalty they say. In America, that type of penalties are not there. They are very severe penalties. So in America, narcotic drugs like methylphenidate, I will give you a very good example. There is a drug called Ritalin. I don't know what name they use it in Indonesia,
yeah.
but the active ingredient is called methylphenidate. Now, methylphenidate is used for hyperactive children. So, if the child is very hyperactive, suppose you see in the classroom that some children are very hyperactive. Children, I am telling elementary school children. So in that sense, the nurse of the every school has a nurse. Whether they do not have a doctor, but every school has a nurse, and if the nurse recommends, then that child is given methylphenidate. Now it is a prescription drug, but then what they do is they put, suppose there are 30 tablets, then they put 15 tablets in one bottle, that is called school bottle. So the child will take that tablet at 12 o'clock after the lunch. Now what children do is they sell the tablet for $5, because that tablet is an addictive drug, and this is where the narcotics are creating problems in the American scenario. Even though they are under prescription, but the accessibility has been comparatively easy. There are thousands of people. If you know the number, you will be surprised. But the last year only, in 2019, 64,000 people have died
Yeah.
because of opioid excess. So they took opium excessively and they died. Opium or pain related drugs. And what is happening is the physician will write the prescription, then they will give the second prescription, they will give the third prescription. And that is where the problem comes into the picture, and that is why the narcotics is a major problem in America.
Okay. Okay, so American have a good awareness about self-care, yes, Mister.
Yeah.
Yeah.
That's why you saw my presentation. I had put more stress on self care. If you can take care of yourself, you will not need these painkillers. If you
Okay.
don't take care of yourself, you will get addicted to the painkillers, and that will lead to a lot of fatalities. So
Okay.
America is now gungo supporting meditation, supporting mindfulness meditation, supporting, thousands and thousands of yoga studios are there in America, and they are attended by a lot of people because people are realizing that rather than taking the pain medication and non-prescription drug, if you can do some yoga, it will help you. And why not? And that is where the awareness is growing on for
Okay.
self-care. Yeah.
Okay, thank you, Prof. The second question for you, Prof. In Indonesia, there are a lot of nutritional product that come from traditional Indonesian plant, maybe. What about nutritional source in America?
You know, lot of products which are traditional in different countries, they are readily available here. So you'll find that in America, in market, you can go and buy the Ayurvedic products, the Indian Ayurveda.
Okay.
And then, there are certain products which are here, which I use it. Oh, where is, have you heard about this? Can you see what I'm showing you?
Oh,
Oh, antangin.
you have Antangin also in
Antangin. And
America.
can
It's
you
a
see this
famous in
one?
Indonesia. Tolak angin.
So these are available in United States.
Wow.
So these are the products which are manufactured in Indonesia. I hope every participant can see them, but they are available in United States. So whatever you are doing it, if you are coming up with excellent products from Indonesia, it has a big market in America. And
Okay.
I strongly recommend, I show this to many of my students. I tell them that this is one of the best medicine for cough and cold. The first line medication, Tolakanjin and Antangin,
So do you like a
they are
tolak angin and
excellent. They are
antangin?
excellent products. So I think there is a market for all these things. There are a lot of nutritional supplement, dietary supplement. The American market for nutraceuticals is almost $186 billion. So if you go to any grocery store, there will be invariably lot of people who will look for these herbal products and medicines. And that's why whenever I come there, I tell them that they should work on creating some high quality jamu products and sell it in American market. They will definitely be there is a huge market for those jamu products.
Okay, okay. So if you go to Indonesia, maybe I will give you a lot of tolak angin or antangin, Prof.
Every time I come there, I buy this. And
Yes.
they are available here also, but here they are very expensive.
Yeah.
In
Yeah.
Professor, don't forget also plus massage.
Yeah,
Okay, the next question for Miss Risa. In the treatment of cold and flu, there are several drugs that contain precursor, and most of people don't always be only in a small quantity, right? How do we as pharmacy overcome this? From
Okay.
Rahmat, Miss Risa, Rahmat Suraya.
From Rahmat. Thank you, Rahmat. As I mentioned before, that we limit the use of the OTC, the free limited free medicines and over-the-counter medicine for only one treatment regimen per case, depend on the diseases. So we have, as a good pharmacy, we have to convince patients that these medicines will be dangerous if used continuously in a long term, manner. Yeah. Plus we explain what the dangers are. Moreover, if the disease doesn't heal after 3 to 5 days, but the patient doesn't want to go to doctor, then it will not be known what the exact cause of the disease is. So it will decrease the patient's quality of life. Okay.
Okay, thank you, Miss Risa. And the next question from Atin Wafirotun Mashuroh. Sorry, Tri Nurlia. For me, Prof. Patak, we know Indonesia had 4 classification of the drug, like free limited drug. How about the America for classification of the drug? Thank you.
Yeah, we do
Maybe I
have
will.
classification of the drugs, and the drugs are classified into different schedules. They call it schedule A, B, C, D, like that. And the classification is dependent on what is the use of the drug. The drugs which are narcotic in nature, which are addictive in nature, they are classified and they are highly regulated medicines like hydrocodone, codeine. These are all highly regulated, cocaine, opium. These are highly regulated drugs and they are very well controlled substances. Then there are certain drugs which definitely need the physician's supervision. So there are many drugs which are used for cancer treatment, and
Okay.
in case of cancer treatment, you will definitely need a physician supervision. Or there are many drugs now. As you told in my introduction, I work with nanoparticulate drug delivery system. So there are almost 45 products which are in market which use nanotechnology for treatment of cancer. But those drugs are not available in the market. So we have different schedules. We have classified different categories of the drug based on their potency, based on their application, and based on the need for the supervision by the physicians.
Okay. Based on their potential.
Yeah, yeah.
Okay.
Terima kasih for the question.
The next question again, Prof. From Atin. We know in several time at news that hydrochloroquine used at America for coronavirus drug. So is that medicine can pharmacy sell without prescription? Isn't right?
You know, in America, hydroxychloroquine or any anti-malarial drug is a prescription drug
With a
because
prescription.
there are no you will rarely when I was looking at the list which was shown by Ibu Risha, all the OTC products, many of those products are not available in America
Okay.
because those diseases are not here. Like we do not have any anti-malarial range of products. If somebody suffers from TB in United States, it will be very tough to get the medicine because TB is not prevalent in America. Like that, there are certain diseases which are tropical diseases which do not exist in America. There
Okay.
are certain diseases which exist in India, China, Indonesia, Africa. You don't find them here. So I remember some 20 years back, one of my friends who was a professor of pharmacology died of malaria.
Okay.
If he would have been in India or Indonesia, they could have recovered him very quickly. But here they had no experience to treat those patients.
Okay.
So hydroxychloroquine is tried by some physicians here, but the FDA is very worried about it. They did not approve it for COVID treatment because they found, the problem is we have to understand that our body systems are built up over the period of time. So we build up our immunity like, you go to a varung, correct? You go to a varung and eat lot of things. Am I right?
Yeah.
Some of the varungs are very clean, but not all the varungs are very clean. Am I right?
Yeah,
Yep.
right.
Obviously, you are exposed to bacterial infections. But because you are eating there day in, day out, you have immunity for that. But if a white bule American goes there and he eats in that varung, he will be sick within no time
Okay.
because that person doesn't have an immunity for the bacteria which are served with the varung food. You are serving the varung food with bacteria. and that's why people suffer from indigestion, diarrhea, and all those things very quickly. But Indonesians don't suffer. I have seen this when I was in Yogyakarta. I used to go, we had a team of Fulbright scholars. So out of our group, there were like 4 or 5 white people. They always suffered. Used to eat in the same room, but they used to have diarrhea and we will not have diarrhea because I had my immunity because of Indian background.
We
So
have a good immunity, Prof.
yeah, the hydroxychloroquine also, the people in Asia have immunity because you have built up immunity by using anti-malarial drugs. But Americans never use it. So they faced some heart problems. So cardiac problems were there and 1 or 2 people died of hydroxychloroquine. So they said no, no more use of hydroxychloroquine.
Okay. FDA report and maybe restrict this product too.
Yeah, yeah.
Yeah. Yep.
And it is a prescription product, so you won't get it in the market
Okay.
unless you have a prescription by the doctor.
Okay. Thank you, Prof. The
Or
next
you know
question,
any Indonesian pharmacist who brought
pharmacy.
the hydroxychloroquine from Indonesia?
Again, the next question for Miss Risa from Fandi. Currently, many prescription drug outside OWA or medicine that must be available are very much sold. How we can as pharmacists deal with this because the number of OWA is very limited and currently really patient want to be directed to see a doctor.
I think that question, thank you very much. Who?
Fandi, miss.
Oh, Fandi.
Yeah.
Fandi, thank you. I think your questions has the same questions with previous questions. I have already told you that for limited-free medicines and over-the-counter medicines, we only limit this use of these medicines to only one treatment regimen per case, yeah, depend on the disease. So we have to convince patients that these medicines will be dangerous if it continuously consumed in a long-term manner. So plus we explain what the dangers are, okay? You have a very similar question with the previous questions.
Okay. Thank you, Miss Risa. And the next is how is the condition of selling prescription drug, especially antibiotic in America, Prof?
You know, in America, antibiotics are a controlled means they are prescription drugs.
With a prescription,
So,
right?
yeah, so you will not have access to antibiotics unless you have a appropriate prescription from your physician.
Okay.
So normally, even for amoxicillin or uh, ciproxine, all the antibiotics are
Prophylaxis.
covered as prescription drugs. They are scheduled drugs, they call it. So you
Okay.
cannot get freely. You have to. It is not a non-prescription drug, so you have to go to your physician. The physician will decide, will do some diagnostic testing, and then appropriate antibiotics will be provided.
Okay. Okay, thank you, Prof. And then the next is currently apart from vitamin, what OTC medicine can we buy in pandemics like this? Maybe you can share about the vitamin.
Yeah, vitamins are readily available. They are all non-prescription drugs. So you can get vitamin. You know, a lot of people are using vitamin D for COVID.
Yep.
Uh, they are using D and D3, and then there are many people. You know, we have like I have a bottle of vitamin C, 1,000 milligrams. It is readily available on the market, and it is a non-prescription drug. And if you keep taking that, so in the beginning when COVID was very high level in Tampa, in my place, I used to take vitamin C almost every day, 1,000 milligrams. Now I am taking it twice or thrice a week because you don't need that kind of vitamin C. But when it was on peak, I tried that and it helped me.
Okay. Thank you, Prof. The next question for Miss Risa. Some of the self-medication that have been mentioned are quite mild disease in the community. Can this self-medication be used for certain diseases such as vertigo and nausea maybe and vomiting? From Jannah, Miss Risa.
Okay, from Jenna. Thank you, Jenna. About vertigo and nausea and vomiting, right? Okay, for vertigo, we have, for example, beta histine. Yeah, we know beta histine that is potent medicine, so that need to be given with medical prescriptions. But nausea and vomiting can be relieved by dimenhydrinate that has OTC logo. So as long as those medicines are included in OTC or limited free medicines or OWA, obat wajib apotek, yeah. So we can give them to patient without doctor's prescriptions. And always don't forget to inform to patients that if the disease doesn't heal after 3 to 5 days, so they should go to the doctor.
Okay. Thank you, Miss Risa. The last question for Prof. Pata. How about the pharmacist's role to manage the self-care?
Pharmacist's role in managing
To managing the self-care.
self-care.
Yep.
The pharmacist plays a major role in self-care because pharmacist is considered to be the first line of healthcare. He is readily available in the shops, and most of the patients, almost they say that 65 to 70% of the patients don't go to the physician, they go to the pharmacist.
Mm.
And pharmacist helps them in their self-care, and pharmacist advises lot of different types of medications and
Mana, Bu?
therapies for them to improve their situations or diseases. And that's why pharmacists play a very important role in the healthcare, and that reduces a lot of burden on the healthcare in terms of hospital and physicians burdens.
Okay. Thank you, Prof. Sorry, there are a lot of questions again, maybe from Gali to Prof. Pata. Uh, sorry.
I see a question here on chat,
Okay.
which is, go ahead,
They send me privately, Prof. This
please go
self,
ahead.
yep, this self medication sometimes become a debate between the pharmacist and physician. How do you respond to this? Maybe they can collaborate so good, or I don't know in America.
You know, all over the world, this is a major problem because the healthcare cake is
Yep.
of a definite size, and the physicians always want the bigger size of the cake. They want the bigger piece of the cake. And now, because we have a lot of clinical pharmacists who are working in the hospital, and gradually the drug business is becoming more and more complicated because modern drugs have a lot of side effects, and hence, and the physicians are not taught in detail about all these drugs and their pharmacology and pharmacokinetics. And this is where in last 10-15 years the role of clinical pharmacist is growing in the hospital, and some of the sensible physicians are recognizing that it is nice to talk to the pharmacist and let the patient talk to the pharmacist so that there is no drug interaction, because one of the major killer in America is the deaths because of side effects of the drugs. Thousands of people die in America because of the side effects of the drugs. And that is where the physicians are learning that unless they come with a healthcare team, so if the team works, the physician, the nurse, the pharmacist,
Yep.
the physiotherapy, the physician assistant, if all of them can work as a team, then only the delivery of healthcare will be better.
Yep.
And that is why in my university we call it USF Health, and our USF Health is consists of Public Health College, College of Nursing, College of Pharmacy, College of Public Medicine, physician's assistant, and then physiotherapy. And all these work as a team, and that is why the more they will work as a team, the more they will respect each other, and that is what is happening around. And it is also the pharmacist has to perform well. Pharmacist should be showing that he is capable of helping the physician,
Yep.
and they will appreciate that.
Yeah. So they have a good collaborate, Prof.
Ah, yeah, yes.
Yeah,
Lot of good collaboration. In last 10 years, it has increased significantly.
yeah, yeah. Okay, Prof. Question again for you. I want to ask about the regulation of medicine in America regarding traditional medicine originating from China. Example, Shinsei.
China and America has a long relationship, more than 100 years.
Okay.
So if you come to any town, all major towns like San Francisco has a very big Chinatown. You go to Los Angeles, it has a very big Chinatown. If you go to New York, it has a very big Chinatown. So Chinese people were in America for more than 150 years now. There is a live contact, and for except before the President Trump came, almost lot of manufacturing was done in China. The Walmart used to do majority of its manufacturing in China. So Chinese products were coming in American market for many years, and if you look at the economy of China, it has grown because they captured the American market. But in the case of COVID now, the things are changing. And after the COVID, the relationship is becoming little bit of stringent, and President Trump is very clear. I don't know whether you saw his statement yesterday. He made a big statement that I am going to ask China to pay money for the losses. Now you can imagine, 215,000 people have died here, and millions have suffered, and for one admission of COVID, it costs $35,000. If you put a person in who has suffered from COVID in the hospital, when he comes out of the hospital, the bill comes to $35,000. So you can imagine, multiply $35,000 with few million people who were in hospital, that much money Trump wants from China. So obviously there is going to be little bit of challenges there, but I hope they have a long-term relationship, and China will also learn some of the things from now, and they will amicably resolve that challenge. Otherwise, China will have a lot of problems.
Okay. You know that the pandemic was increased about the COVID. And what about the vitamin? Can you choose like a vitamin C, echinacea, or multivitamin at America?
Yeah, I mentioned that a lot of people are taking vitamin C and vitamin D3 as a
Okay.
preventive measure, preventive self-care. Lot of people are opting to turmeric, because some of the
Turmeric.
people, yeah, turmeric, they liked it and it works for them. So based on there are if you go to any pharmacy now or grocery store, you will find there are hundreds of products which are called as immunity boosters, and those immunity boosters, their sale has gone significantly higher because of the COVID, because people have realized that we need to build up our immunity, and that's where the things are happening.
Okay. So about the echinacea, Prof.
Pardon?
About the echinacea.
I, it is available readily in the market. They sell
Oh,
the capsules also. Yeah,
okay, okay.
echinacea is there, but it is not as popular as the other medicines. Turmeric became much more popular than this, but
Echinacea.
there are many immunity boosters are there. They are using it large
Ah,
scale.
so we can export this turmeric to America
Oh,
maybe.
absolutely. Yeah, yeah, you can. So you start a company in Samarang.
Maybe we can barter with Antangin, Miss Risa.
Yeah, yeah, yeah.
Okay, and the last for Miss Risa, what is the principle of self-medication for chronic disease such as allergy?
For chronic disease, from who asked this question?
Jana.
Jana, thank you very much, Jana. For chronic disease, of course, we have to see at first what chronic diseases are that need to be given this kind of medicine for self medications. But if you mention allergies, we can give antihistamines to patients, and some antihistamines have OTC logo, and some of These antihistamine have potent medicine logo but are included in OWA, Obat Wajib Apotek, yeah, as I mentioned before. Maybe such as dexclorpheniramine maleate, yeah. So yeah, we can help patients to overcome symptoms of allergies without medical prescriptions. But again, we have to tell patients that if the disease doesn't heal after 3 to 5 days, we have to suggest to patient to see a doctor. So as long as the medicines have the OTC logo or limited free medicines logo, and some of them are included in OWA. So yeah, we can give them without medical prescriptions as well.
Okay, thank you, Miss Risa and Prof. Patak. Maybe it's so discussed. Maybe the question is enough for us right now. Thank you, Prof. Patak, Miss
Ya,
Risa.
Thank you very much. Arigato
sampai jumpa.
gozaimasu. Sampai
Sampai
jumpa.
jumpa.
Sisi
Take care.
Niman. Take
Bye.
care, Professor. Bye.
Okay, ladies and gentlemen, we are come to the last agenda. We would like thanks for the speaker and all of the audience for being active participants. And then the conclusion from the presentation today, self-care have many benefits to reduce minor disease. And as pharmacists, we can take a role in choosing the right drug like OTC or limited free medicine and give counseling maybe. This is our challenge as a pharmacy. Okay, hopefully the discussion will give the benefit for us. Thank you for your attention. Don't forget to do your post test. See you later. Wassalamualaikum warahmatullahi wabarakatuh.
Bye.
Bye. Uh, Maybe we can take a picture first, Prof. Mm-mm.